Hello to one and all. This is going to be my sports injury webinar. My topic is on ankle inversion sprain. So, how do you get an ankle inversion sprain? An ankle inversion sprain is when the ankles roll inwards, and the ligaments on the lateral part of the ankle gets torn or injured. This can also happen when you walk on an uneven surface where you will roll your ankles, landing a jump wrongly, and lastly, playing sports that involves cutting movements. For example, basketball, football, tennis, badminton, rugby, etc. What is an ankle inversion sprain? It is when any of the three ligaments on the lateral side of your ankle tears. It consists of three ligaments, which is the ATFL, CFL, or PFL. This injury is actually very common. It is one of the most common injuries. It makes up 40% of all athletic injuries and 85% of this injury occurs on the lateral side of the ankle. This can also happen when there's a fracture where one of the bones or any part of the bone break. Before we get started, if you don't know what a ligament is, I will explain. Ligaments are made out of individual fibers. They are short, tough, flexible, and they connect the bone to each other. If you didn't know what those three ligaments that I stated before this, what they stand for, here they are. The first is the anterior talofibular ligament, the ATFL, which is this one. Second is the calcaneofibular ligament, the CFL, which is located on the very bottom and is the longest one. And the third is the posterior talofibular ligament, PTFL, which is located there. How bad can your ankle sprain get, if you're wondering? There are three degrees of injury to it. The first is grade 1, a mild ligament tear. This is when there are tiny tears in the ligament and it's not that severe. It'll take a few days to recover. The second is a moderate ligament tear, a second degree tear. The third is a severe ligament tear. It is when the ligament tears off completely, and it will take a few months, which I will explain furthermore in future slide. How long does it take to heal an ankle sprain? It really depends on the severity of the injury. It depends on how bad your injury is, which I will demonstrate and explain through injuries in sports, and I will use examples on players. The first, 2016 NBA League MVP, Mr. Stephen Curry. This was when he rolled his ankles inwards while playing in the quarterfinals of the Western League Conference against Houston Rockets. It took him 2 to 3 weeks to recover fully, but he was playing again after a few weeks. Second is Mr. Jack Wilshere. This was when he got tackled. This was a couple years back when he got tackled by a Tottenham player, if I'm not mistaken. This took him 4 to 6 weeks to recover. And the worst one, is the third degree injury. Third degree injury, Mr. Geoff Jenkins, Major League Baseball player. It took him 6 to 12 months actually to recover, not 6 to 12 weeks. That is a technical fault. Complications of this injury and bones affected. Bones affected are the tibia, which is your shin bone. Second is your fibula, which is the thinner bone that runs next to the tibia. The talus, which is the bone of your ankle. Complications. If not treated with care, it might lead to chronic disability and need to be addressed with therapy or surgery. Muscles and tendons affected. The peroneus brevis muscle, which is on the side of your calf, and for tendons, it is the peroneal tendon. It connects your calf muscle to your foot. How do you treat an ankle sprain? Well, initially you have to follow the RICE rule, which is rest your ankle, ice it to minimize swelling, compress your ankle to minimize or avoid swelling and support it, and elevate so there's no pressure or weight on it. Here are the physiotherapy exercises and activities you can do to recover your ankle. The objectives of physiotherapy is to protect the injury, regain full range of motion of your ankle, strengthen your ankle and calf muscles, restore joint balance, restore normal function, graduated training, and return to performance training. This is when your ankle has been fully healed. Here are the recommended exercises for ankle sprains. The first is the ankle circle exercises. This is when you rotate your ankle counterclockwise and clockwise. Make sure you lift your toes off the ground so that your injured foot balances on your heel, and sit on the floor. The second is resistance tube exercises. This should be done after the first one, which was the ankle circle exercises. This is when your ankle has been healed up to 60 to 70%. Make sure you sit with your heels on the floor and knees bent. Loop one end of a rubber resistant tube onto the leg of a table or bench. Place the other end on the front of your foot. Without moving your knee, bring your foot in towards your body and away from the table. And the third exercise is the parallel resistant band exercises. This exercise works your peroneal brevis, the muscle that I mentioned earlier, and it stretches your ankle ligaments. Wrap the band to the outside portion of your foot and the table. Pull away until you can't go further and repeat. This is of course the exercise that you should do after you are up to 90% recovered. That is all for my presentation. I hope this has been helpful, and if you have injured your ankle in any way, hope you get better, and you will be alright if you listen to the previous steps. Thank you.